Thank you for coming. I promise to never say you all, but thank you all for coming. May I have my first slide, please? The next slide. And the next one. Well, some would say that I was born to be a surgeon. My grandfather was a surgeon and a minister and an artist. I had an uncle who was a surgeon, another uncle who was a dental surgeon. And to help take care of all of us, I had an uncle who was a psychologist and everyone's favorite uncle, the liquor store owner. My father was a computer genius and my mother is an opera singer. And the strongest one of all of us was my grandmother, the matriarch. Next slide. And from this family of origin, I learned and gained so many strengths, like confidence and learning to communicate directly and striving for perfection and working hard and doing my best to stay calm and in control. And with those strengths, I felt like I had everything I needed to succeed in life, in training, in being a spouse and a parent. Next slide. Oh, go back a little bit. And 5 years before my accident, I felt like I was living the American dream. My family and I had just returned from a medical mission trip. My children were attending top schools. I had a child at an Ivy League school. And I lived in a house that was more beautiful than I could have ever imagined. I was driving the truck of my dreams. And I had just been promoted to the vice chairman of orthopedic surgery. And then tragedy hit my family. And I soon realized that everyone in my family, including myself, was suffering from a life-threatening illness. And I'm not at liberty to talk about their issues. I can tell you about mine. And mine were all stress-related. Next slide. Stress that I didn't even realize I had. I had hypertension, and pre-diabetes, insomnia, unrecognized anxiety, and unrecognized depression. And I had a tremendous amount of emotional pain as a result of a traumatic divorce. And it was around that time that I was introduced to a book by Alan Watts called The Wisdom of Insecurity. And in that book, he talks about mindfulness and the ability to live in the present moment without worrying about the future or dwelling on the past. And soon, I found this book called This Moment is Full of Wonders. Next slide. By Thich Nhat Hanh. And that book has a collection of some of his calligraphy. And I opened the first page and it said, breathe. And I'll invite you to close your eyes or have a slightly downward gaze and breathe. And the next page said, breathe, my dear. And the next page said, listen. Now take a few more deep breaths. And when you're ready, come back to the room, open your eyes, and look. Next slide. I soon started practicing moving mindfulness with yoga and took a course called mindfulness-based stress reduction. And I downloaded an app, a mindfulness meditation app that allowed me to listen to 3 to 5 minute meditations several times a day and 20-minute meditations at night while I wasn't sleeping. And soon I started practicing one of my favorite things to do. Next slide. Every time I washed my hands, I would close my eyes and turn on the water and breathe. And on my next in-breath, I would smell. And on my next out-breath, I would taste. And on my next in-breath, I would listen. And on my next out-breath, I would feel. And I continued to smell and taste and listen and feel until I felt calm and ready to open my eyes. And no matter what was going on in the operating room or in the office or at home, I could find peace and serenity by getting in touch with my breath. And soon, my blood pressure normalized, my A1C normalized, and I could sleep through the night. And I felt like I had found equanimity, which is the ability to feel calm, even in difficult situations. But what I didn't realize is that I was in a spiritual bypass. Next slide. And I came to this realization when I was at a family retreat. And there was chaos all around me. And everyone in my family was experiencing difficulties. And I felt peace. And at the end of the retreat, I thought that the counselor would tell me how amazed she was that I could find peace with so much chaos around me. But instead, she wrote, "I'm concerned that you may never experience the fullness of an emotional life. And you may benefit from individual therapy." I was devastated when I read these words because I thought I had found the solution to all life's problems. And this allowed me to self-reflect. And I realized that I'd been suppressing all of my emotions my entire life. And I couldn't feel difficult emotions like fear and anger and sadness. And I soon found this course called Awakening the Fearless Heart. Next slide. By Tara Brach. And she taught me that in order to be fearless, I needed to be able to feel fear. In this course, most of this course is embedded in this book called Radical Compassion. And in that course and in this book, she taught me how to feel emotions using a tool called RAIN. Next slide. Where R stands for recognize that I have a difficult emotion, and A is allow that emotion to occur, and I is investigate where in my body I feel that emotion, and N is to nurture myself with deep breaths. And I'd like to share a time when I was operating on the 10-year-old girl with a recurrent osteosarcoma of the lumbar spine. And when we were dissecting the tumor off the inferior vena cava, I noticed a tremendous amount of scar of the tumor on the vein. And I recognized that I had fear. Fear that I couldn't get the tumor off. That we wouldn't be able to save her. That I would get a hole in the vein. That I wouldn't be able to stop the bleeding. And we could lose her. So I closed my eyes and I allowed this fear to occur. And I investigated where in my body I felt this fear. And I nurtured myself with deep breaths. And I smelled and I tasted and I listened and I felt. And I continued to reign until I noticed my heart rate came down and I could open my eyes and finish the operation. And I talked to the resident who was with me that day, and she told me she didn't even notice I paused. I soon entered a parent-driven recovery program. Next slide. And I entered that program to help save one of my children. What I soon realized is that I needed recovery as much, if not more, than my child. I needed recovery for my severe codependency. Next slide. And not codependency as I once knew it, but codependency that showed up as my family of origin strengths that had gotten out of proportion and become weaknesses. Confidence became judgmental thinking. Direct communication led to numerous violations of other people's boundaries. And striving for perfection led to perfectionism. Working hard led to workaholism. And staying calm and in control led to the need to be in control of every situation at work and at home. And I learned so many tools to recover from my codependency. And it was with this group that I was on a mountain bike ride at Memorial Park. Next slide. With a group of parents and teens. And I was on the trail and I saw a hole. And I knew my bike would roll right over that hole. And as I was going over the hole, the next thing I noticed was I heard a crack. And I wasn't sure what that crack was. I thought that crack could be my helmet or my skull or my neck. So I kept my eyes closed and I started to breathe. Next slide. And on my next in-breath, I smelled. And on my next out-breath, I tasted. And on my next in-breath, I listened. And on my next out-breath, I felt. And as I continued to breathe, the title of this book came across my mind called Radical Acceptance. And I knew it was important for me to radically accept whatever that crack was. And I also knew that I could ask to be granted the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And as I continued to breathe, I heard my friend yelling my name in a panicked voice. Next slide. So I asked him to touch my foot and tell me if it was moving. And he said he was touching my foot and it wasn't moving. So I knew that crack could be my back and that I was paralyzed. And I asked him to touch my hand and tell me if it was moving. And he told me he was touching my hand and it wasn't moving and I couldn't feel him. So I knew that crack was my neck and I was paralyzed. And there was less than 5% chance that I would ever walk again or ever operate again. And I also knew that I may never hold my unborn child or hug my other children. And I also knew it was important for me to get to the hospital as soon as I can. So I helped coordinate my rescue. And when I got to the emergency room, my surgeon showed me my CT scan. Next slide. And my spine was dislocated at the C3-4 level. And miraculously, I was able to get into the operating room within 2.5 hours of my accident at the same place where 5 years before, it was difficult for me to get my patients into the operating room within 24 hours. After my surgery, my surgeon came to me and showed me beautiful images of my spine perfectly reduced and the screws and rods in great position. And he said to me that most people with your injury and severity benefit from a tracheostomy. I didn't want a tracheostomy. So I took a deep breath and there was nothing. That amazing, beautiful thing that had given me such peace and serenity was gone. Life had taken my breath away. Next slide. My recovery program had given me so many other tools. Tools to find peace. And one of those tools was the Panda Planner. And this planner is a program designed to cultivate optimism. And every day, I would write down 3 things I'm grateful for, 3 things I'm excited for, a daily focus, and a daily affirmation. And every day in the ICU, and every day since that accident, I would list the same things. I'm grateful for breath. I couldn't breathe on my own, and I was grateful for every breath the ventilator gave me. I'm grateful for life, and I'm grateful for my recovery program, which gives me good, orderly direction. I'm excited to see my family. I'm excited to see my friends. I'm excited to see my caregivers. And my daily focus is to do my best to be mindful and live in the present moment without worrying about the future or dwelling on the past. And my daily affirmation is, I am enough. I am enough. Because I didn't and don't always feel like I'm enough. And I am enough. I also started my day with a loving kindness practice. Next slide. And I'll invite you to close your eyes or have a slightly downward gaze and silently repeat the following phrases. May I be kind and compassionate. May I be humble and accepting. May I be honest and accountable. May I be forgiving and committed. May I love kindly and kindly love. Now take a few more deep breaths. And when you're ready, come back to the room. and open your eyes. While in the ICU, I had a vision of Christopher Reeve. Next slide. And I remembered how much he had done for the spinal cord injury community. And I knew there was a plan for me, a plan that now includes increasing awareness around spinal cord injury and mental health. And I was hoping that I could introduce at least one more person to a moment of mindfulness, and that I could help raise money to find cures for spinal cord injury. What I didn't realize is that part of that plan would be to share with you some of the things I learned about the harmful effects of generational shame and the power of parenting with love. Next slide. I learned that the potential strengths from my family of origin were taught to me in a shaming way, and that the message I received was that I'm flawed and a bad person if I wasn't perfect. And I learned that I passed this shaming message on to my children. I also learned that all children are born precious and mindful. And that when we teach children with shame rather than unconditional love, that they become less mindful and unable to experience emotions for the usual 90 seconds that the body feels an emotion. And then they hold on to these emotions as thoughts and get lost in thought and unable to live in the present moment. And they start to worry about the future and exhibit signs of anxiety and dwell on the past and exhibit signs of depression and sit in anger and exhibit signs of opposition and defiance. And as the shaming continues, their thoughts become judgmental and self-victimizing. And they become overly attached to things like perfection and work and people-pleasing and love and relationships and gaming and social media and gambling and substances. Next slide. And as I was learning those things, I watched my precious 6-month-old child mindfully experience happiness and sadness and frustration. And I saw in the moment of frustration, his grandmother shaming him with a scornful look and a wagging finger. Oh no, we do not do that. And I notice that most of the time, when people called his name, they used a shaming and angry tone. And thankfully, I had more knowledge. And I could do as Dr. Hamp teaches, speak to him with soft eyes and a soft face and a soft voice and utter his name in that way. And I had the courage to ask others to do the same and to ask his grandmother to no longer shame him and wag her finger in front of his face. Next slide. And as we were teaching him to be respectful and grateful, I realized that I never modeled respect and gratitude, and that I never said please or thank you my whole life, especially in the operating room. And this time, I was able to show up differently and model gratitude and respect and say please and thank you. Next slide. I love you. You're such a good boy. Sweet boy. I never said these things to my older children. Maybe it's because I didn't want them to grow up weak. Maybe it's because I never heard these words growing up. And I learned from my parent-driven recovery group how to say, I love you. I love you. And I learned from Eva Prapata the importance of telling him that he's such a good boy. Because she told me he probably never hears it from anybody else. And Dr. Hemp taught me the power of conveying love and affection by telling him he's such a sweet boy. And Dr. Hamp also taught me this quote from Brooke Hamilton: speak to your children as if they are the wisest, kindest, most beautiful, magical persons, humans on earth. Because what they believe is what they will become. And Kai knows I love him and that he's a good boy. Next slide. And I think the most beautiful thing that I learned about parenting with love was something Kai taught me. And he was a couple years older than this boy. And he dropped some food on the ground. And I said, Kai, will you please pick that up? And he half-heartedly leaned over the bench and was barely grasping for the food. And his grandma looked at him and said, Kai, you need to pick that up. I said, Mom, will you do your best to say that with love next time? And as he started to pick up the food, she said, Kai, you need to pick that up. And he looked at her and he said, with love, Grandma, with love. Next slide. Mindfulness helped save my life before, during, and after my accident. And learning about the harmful effects of shame and the power of unconditional love helped me become a better person and a parent. Thank you so much for this amazing opportunity. I love you.